And now maybe to turn from pharmaceuticals to medical devices. Nicole, I give you the floor.
Thank you very much. Thank you very much. I'm delighted to be here and hope that you had a good cup of coffee. I'm very pleased to talk about innovation. Innovation is, in fact, a very exciting terminology, but I did like the introduction you made between invention and innovation. So it's quite interesting, that something that may need to be developed later on. So for those who don't know me, I'm Nicole Denjoy. I am Secretary General from COSIR. COSIR is a European trade association. We are representing industry, medical device industry. And this association was created back in 1959. We are based in Brussels, and we have an office in China. China is a big market. So, so today I'm going to talk to you about how innovative our industry is. It's really very exciting to see also how this innovation can directly impact economic growth of the countries. Yeah. So again, in a nutshell, COSIR is a non-profit association. We are very focused. We cover three big sectors. One is medical imaging, e-health, and electromedical. So two of those sectors are highly interesting when we talk about sustainability of healthcare systems, as medical imaging is a non-invasive technology that has proven a lot of innovations, and the health ICT is what I consider to be the glue whenever we start to provide integrated care systems. And of course, I am also in my free time chairing the task force on health policy, representing the private business in front of OECD Health Committee. It is important also to respond to questions that some regulators have, as what to do more with less. So I believe our two key industry sectors are in fact key on this aspect. So our members are in fact providing product and services covering the continuum of care. I'm also pleased to say that our technologies are not only covering sick patients, it's also for healthy citizens, and our duty is also to make sure that all of us, we keep healthy as much as possible, and so this is the reason why prevention is very important. So two types of members. I'm not going to spend time. What is unique in COSIR is that we have the traditional healthcare industry, all the medical imaging, Philips, Siemens, GE, a lot of European companies investing a lot in research and innovation in Europe. We have also IT companies, and we have also telecommunication company. Why? Because we are talking about telehealth, telemedicine, and those are also playing an important role. We have also national trade associations, and we don't have the 28 national trade associations, but those are bringing a very important number of SMEs, small and medium enterprises. Only with all these national trade associations, they're representing more than 7,000 industries in Europe. You may know that the healthcare ICT brings about 1,500 companies, 80% of those in Europe are being small enterprises. So I'm not going to spend any time on this. We know all the challenges. Other privileged speakers have been mentioning the challenges that we are facing, but let's say 35 million deaths are coming from chronic diseases. 60% of those deaths are resulting from chronic diseases. When you look at total cost of public health, it's 75%. So we need to be cost effective. And we know that deaths from chronic diseases will increase by 17% by 2015. In terms of innovations, we have great innovations in three big domains: on the diagnostic, on biotech and genomics, and on IT and bioengineering. Just to name a few, in diagnostic you have molecular imaging that is pretty promising. We have also miniaturization, portability. On biotech and genomics, now we know and we understand more on the benefits of biomarkers. Also imaging biomarkers are playing an important role. Screening, rapid screening important as well. And IT and bioengineering, e-health, telemedicine are what I call the glue that are providing those efficient solutions that in principle are providing better access to healthcare, better quality, reducing errors and cost efficiency in terms of total cost of healthcare. Innovations, I just wanted to bring two examples. One on cardiology, where thanks to the type of technologies that has been innovative over time, we've seen that around 70% of the survival improvement in heart attack mortality is a result of changes in technology, so we should not forget about it. Another example is another example is on oncology. When you look at three types of cancer, then you can see the figures showing how much deaths have been going down, and this decline in cancer has a little to do with improvement in late stage treatment, but more to do with prevention, early screening, early detection of treatment. Now we are saving more and more lives with these kind of non-invasive technologies. E-health, as I mentioned, is also an excellent and efficient technology. The problem is that not everybody understands what are all the benefits, and for this I think we need to still do more building awareness of what are the benefits of e-health. People are more frightened than they understand exactly what it could bring. But I think things are moving like baby steps, but those baby steps, the babies are growing, and those should move faster. And we have Clemens Hauer here co-chairing the e-health network at the European level, who is doing a tremendous job on this. So healthcare IT has shown proven high clinical and societal value. Telehealth, we see now it's coming. Denmark has already implemented really concrete things. I was in a congress in France. France and Germany are working together also on how to make things happen. But of course, for this, you need a little bit of IT infrastructure and IT connectivity with different types of standards. And of course, more and more, we needed to bring under the light what are the best practices. Personalized medicine. So this is also another way to look at how to efficiently treat patients, because we've understood, with all the researchers, all the inventions that have been done, and we better understand how things are working. We know that we can improve clinical outcome driven by molecular understanding of disease. We can reduce damaging side effect and treatment cost through tailored treatment, because now with those non-invasive technologies we can trace the molecule and see whether it is efficacious or not, and then have a better, more efficient patient management. So just in a nutshell, medical imaging, when you look at what it was a few decades ago and what we have now, you can see that we have medical imaging in 3D. You can, I would say radiology was one of the technology that a few decades ago found the necessity to transfer images, from one point to another. So a lot of innovation being done at that point. when you look at personalized medicine, again, from anatomy and function to a molecular understanding of disease. I'm not going to go through all these, but you will have food for thoughts later on. The presentation will be available. When you look at breast cancer, in fact, you see the breast cancer cycle. It's rather interesting. Here it's just giving you in a nutshell what are the different stages of the breast cancer disease with predisposition, screening, diagnosis, staging, etc. And it's interesting to see how prolific the industry has been in terms of innovation, together with the researchers and with academia, in identifying new technologies that are those existing today that are in green, and the other ones are just under development, again with a strong cooperation with academia and researchers. So we are saying now we need to move from sick care to health care. Let's say we've been really focusing on acute conditions, hospital-centered, physicians-dependent, passive patients, and nowadays we are moving towards more community-centered, team-based, knowledgeable patient. Patients are more interested to know more about their health. And also, patients do not like to stay too long in the hospital. So we see also a way to reduce hospitalization and to have better quality of life staying home. So the industry cannot solve all those challenges together. We need, of course, investment and research that are associated with high risks. We see also, unfortunately, low speed of adoption of new technologies with derived clinical and economical benefit. I heard a health technology assessment. Health technology assessment is a fancy terminology, but I think that we need to go beyond assessing the technology. I believe we needed to assess the processes rather than just the technology, because when you see, for example, a scanner can be used for healthy patient, but for early treatment, etc. You needed to assess the whole process if you wanted to have a great picture. This is one of my last slide. In fact, what we need is a mechanism to have robust evaluation of innovation, rapid access to market if we want to benefit, strategy at EU level to support innovation with funding, Horizon 2020, research and development. So my last slide is smart evolution and great opportunities. Technology and its innovation have contributed to increasing life expectancy and quality of life, providing better access to healthcare, reducing health inequalities and medical errors, keeping citizens healthy longer. So population, the active population, is then building the growth of the countries. If you have healthy workers, then the growth of the country automatically will follow. So, and of course, if the economy is growing, then jobs will continue. And it is with those innovations that the job will continue to grow with the economic growth of the country. Thank you.
Thank you very much. Thank you very much as well. So you have, I think, very clearly shown the really multi-layered contribution of the medical devices industry. I thought your slide on breast cancer was really very powerful. At all these different stages of a disease, you have this different kind of contribution, and you made the point about growth and jobs at the end, so I won't ask you about that. But I wanted to try and make a link between the two presentations, because there seems to be a theme here about evidence, and about evidence which is not just evidence of the one technology, but the whole process of care and in the real life, so that it's comparative evidence about what is an actual treatment. Do you see similarities between what you're saying and the payer perspective that we heard from Rolf at all?
Definitely. In fact, if nobody is paying for, then innovation is not worth. So, but I believe we need different ways of, to pay. In fact, we've seen some innovative ways, let's say, to reward healthcare professionals to keep the patient healthy instead of being paid on number of prescription, etc.
Yes, we are a bit careful because we were told too often this is innovation, and we had to pay it, and later found out it was no innovation. But on the other hand, if there really is an innovation, we can't afford not to pay for it, because then our members will either go to the High Court or something like that, and will force us to pay. So we pay at the end.